Welcome to HITshow, your go-to source for today's leading healthcare business headlines. I'm your host, Klein. Today we'll cover hospital margins, looming cost pressures, and how AI is reshaping both clinical trials and cyber attacks. We'll also look at arbitration costs under the No Surprises Act that are straining providers nationwide. We start with innovation in clinical research. Cleveland Clinic is turning to artificial intelligence to speed patient enrollment in oncology trials. Nate Collier has the details.
Cleveland Clinic has partnered with Dyania Health to use AI that combs through clinical records and eligibility data, matching patients to cancer trials faster. The goal is to overcome one of the biggest bottlenecks in research, finding the right participants at the right time. What makes this significant is scalability. By applying AI to routine EHR data, hospitals could expand access to experimental treatments for thousands of patients who might otherwise be missed. The move also reflects a growing trend of academic medical centers leveraging AI not just at the bedside, but across research infrastructure.
Nate, how soon could patients see benefits from this partnership?
Pilot deployments are already underway, with broader rollout expected in 2026.
Now to provider finances. Intermountain Health is one of the few systems posting solid gains this year. Teresa Vaughn has more.
Intermountain reported a 5.4% operating margin for the first half of 2025. That's thanks to disciplined cost controls and aggressive management of non-clinical expenses. The system's strategy goes beyond cutting costs. They've been investing in shared services and technology modernization, which reduced overhead while freeing resources for clinical operations. Analysts say Intermountain is positioning itself as a benchmark for efficiency in a year when many systems are struggling to stay above water.
Teresa, does this raise the bar for how peer systems approach their budgets?
Absolutely. Intermountain is setting an example that others may need to follow, especially when margins remain thin across the industry.
Speaking of budgets, the road ahead may get tougher. Peter Betterworth reports on looming cost pressures for 2026.
Analyses point to higher Medicare premiums and significant cost shifts to employer-sponsored plans next year. Experts warn this could strain both hospitals and patients, reinforcing the urgency of contract planning and subsidy extensions in Washington. This isn't just a short-term issue. A new Kaufman Hall report emphasizes that hospitals will need to identify structural savings, particularly in non-clinical spending, to absorb these pressures without cutting into patient care. If premiums rise as projected, employers are also expected to shift more costs to workers, which could further depress patient volumes. For hospitals, that means double exposure, higher uncompensated care risks, and tighter margins. Leaders who delay planning may find themselves negotiating from a position of weakness when payer contracts reset.
What are the broader implications if these projections play out?
If 2026 unfolds as analysts predict, we'll see heightened tension in labor negotiations, more aggressive payer strategies, and possibly another round of hospital consolidations. Kaufman Hall makes it clear systems that start tightening non-clinical budgets now will be far better prepared for what's coming.
So bottom line, proactive systems win, reactive systems lose.
Exactly. Those who plan ahead will manage the transition. Those who don't could be caught flat-footed.
After the break, ransomware gets an AI upgrade, making attacks faster and harder to stop. And later, a closer look at the mounting costs of surprise billing arbitration. You're listening to HITshow.
HITshow is made possible by Altera Digital Health's Sunrise EHR, the flexible solution that provides tools and technology clinicians need to deliver better care, their way. The journey toward the summit of healthcare has begun, and through partnerships built on trust, Sunrise is helping healthcare organizations bring next-level care within reach.
Welcome back. Hospitals are staring down a new wave of cyber attacks powered by AI. Anika Shah has the story.
New Wired magazine reporting shows threat actors are using generative AI to automate ransomware campaigns end to end, from phishing emails to file encryption and even ransom negotiations. This lowers the barrier to entry for attackers, meaning more campaigns launched with fewer resources. What's especially alarming is the scale. Researchers say these AI powered attacks can run continuously, adjusting tactics in real time to bypass hospital defenses. Security leaders warn that hospitals can't rely on outdated playbooks. They must increase tabletop drills, aggressively test backup systems, and harden multi factor authentication now.
Anika, are hospitals already seeing this in the field?
Yes, several recent attacks bore clear AI hallmarks, including near perfect phishing lures and adaptive malware. This isn't theoretical, it's happening, and it's only getting sharper.
Finally today, a policy story with big financial consequences. The No Surprises Act was designed to protect patients, but its arbitration process is drawing scrutiny. Logan Stokes reports.
A new health affairs analysis finds arbitration fees have already exceeded $700 million, with providers often absorbing the costs. Hospitals say the process is draining resources that should go to patient care. The problem lies in volume. With tens of thousands of disputes being filed, the administrative costs of arbitration are skyrocketing. Unless Congress intervenes, hospitals warn the system will continue to siphon money away from clinical services, the opposite of what lawmakers intended.
Logan, is there bipartisan support for making changes?
Yes, there is some momentum on both sides of the aisle, though the details of reform remain unclear.
That's all the time we have for today. Thank you for joining us on HITshow. If you liked these stories, please follow us on LinkedIn and check out our in-depth feature videos on hit.show. HITshow, your go-to source for healthcare business news, can be found all the places where podcasts are heard. Please join us again tomorrow for the latest headlines in healthcare. HITshow is made possible by Kimchi. Transform your team with an agentic AI workforce that creates, optimizes, and distributes marketing content while keeping the human touch. For an AI workforce powered by you. Kimchi.com.